Hi everyone, I'm Maureen. I'm a nurse practitioner and owner of Clinique and Beauty in Cincinnati, Ohio, and today we're going to talk a little bit more about the Sciton Forever Young BBL. Forever Young BBL, it's known for correcting color. So that is its main thing. It's correcting browns and reds. When you start getting into the Forever Young, this technology is actually amazing because it came from studying plants. And we know that when plants are alive in the spring, they're nice and green, they're real youthful and everything. And then all of a sudden cold weather comes, sunlight gets less and they kind of go dormant. And so someone much smarter than I thought to themselves, like, if light and heat affect plants, what would it do to the skin? So that's exactly how this technology came about. As we get older, we have certain gene expressions turning on and turning off. And the best way I can describe that is when you have a 5-year-old boy, there is a gene in his body that says make facial hair, but it's not turned on until something goes and all of a sudden he's making facial hair. Well, we have those kind of expressions being turned off and on throughout our life. So what this does is it uses heat and light. So the heat is really where it comes in with the skin tightening to keep those youthful genes turned on longer and suppress older genes from coming on. And that's why it's called Forever Young, is because the combination of heat and light keep our skin acting as if it was younger. So the BBL itself stands for broadband light. It's a technology that uses different wavelengths of light to target really mostly color, as we're talking about Forever Young. But it also does treatments Forever Clear and Forever Bare. Forever Bare is hair removal and Forever Clear is for acne. But with Forever Young, we focus mostly on brown spots and red vessels. Depends on the state that you're in. So in some states you have to be a physician. In other states you can be an esthetician, and most states are somewhere in between. My background is nursing. I was a nurse for 10 years before becoming a nurse practitioner. I've been a nurse practitioner for 14 years. And once I decided to get into aesthetics, I knew that safety was the biggest concern when working with these types of machines. Most of my interest came from me personally. At the time, I was getting into my late 30s and I was starting to see wrinkles and brown spots and lines that I didn't like. And when I looked at the aesthetics, not only was I intrigued by it, but I was also confused by it because there are so many things out there and it starts to kind of mesh together, like this is the best and that's the best. And so I really wanted to figure out for myself kind of what I needed to do at that age to kind of delay aging and to stay youthful looking. So that's kind of how my journey started, was for me personally. Using these types of machines, you have to be careful. You have to go to someone that's skilled. You have to go to someone that knows what they're doing. I initially did training in Scottsdale, Arizona at the National Laser Institute. And really there, we spent a week training on every device that is available in the United States. Every day we'd go in and we'd learn about a different technology, the safeties of it, the efficacy, what the ideal patient was, and then we practiced that day. So I not only got to work on this device, but I got to work on a lot of other devices. And really the purpose of that was really to make sure that we understood how lasers work, how light-based therapy work, and for safety. This was the first thing that I used. There was lots of things to choose from. I chose this laser because of the platform on it. You can add lots of different hand pieces and things like that. But the other reason why I chose it is it's made in America. It's made in California. It's kind of like the Cadillac or the Mercedes-Benz of machines. Just like cars, there's different qualities. And I felt like this was a great quality device because of its safety and because of the results that you get from it. Obviously, when you're looking at devices like this, you kind of interview lots of companies. You look at what they offer, what's the pros, what's the cons, how the mechanics work, all that kind of stuff. So once I decided on this machine, they come in and do a 2-day course. And the manufacturer comes in and does a very intense course on, again, safety, how to use it, the appropriate patient, that type of stuff. So Sciton does a great job of offering ongoing courses via the Zoom. They do stuff where they come to the city and train people. And then in addition, there was an opportunity to go to California a couple years ago where we actually got to train with Dr. Bitter. Dr. Bitter is one of the main physicians that works on this platform and comes up with technology. I knew there was things with the machine that he did that aren't part of your typical training. So he does advanced settings, he does advanced treatments. But for me, I want to be the best at it. I want to be able to use this to my full advantage. I want patients, when they come in and see me, to get the best results possible. BBL, when we're talking about it today for the Forever Young portion, is really for people that have pigment, whether that's sunspots, just photo damage. It's also great for people that have redness, so the vessels in their nose. It's great for people with rosacea. It's really good for anyone because it also has a component of anti-aging to it, and that's why it's called Forever Young. Once they come in, I see everyone before we start a procedure to make sure they are an appropriate candidate, make sure there's no contraindications to using this. So a contraindication really for this one, a main one, is like seizures. Anything that, because we're using flashlight, anything that could be, any eye issues, things like that is the biggest issue. We do use goggles. We use a metal goggles. Actually, it's these little guys here. We use these to help. But people that do have sensitivity to light, because the light is so bright, you can still see flashes of light even with the goggles. So we just take precautions and kind of eliminate those patients from something like this. So prior to having the procedures, we love to get baseline photos. And it's not only for the patient having it done, but it's also for us. So we use a camera called the Vizia, and that is a software that takes pictures from 3 sides. But the one thing I love about it is it grades your colors, it grades your sun damage and your brown spots. It also grades how much redness you have. But it also gives me another piece of information, which is what color is their natural skin. So the biggest part of being safe on these machines is getting something called the Fitzpatrick score correct. So the Fitzpatrick score is how much natural melanin you have in your skin, and that is a scale of 1 through 6. So a 1 is someone that's very pale, blue-eyed, probably blonde or even redhead, that when they go out in the sun, they would burn almost instantly but never hold a tan. A 6 is someone that has black hair, very dark eyes, very dark skin, that just get dark when they're out in the sun, and the rest of us fall into the middle of the range. And this machine is really based off that Fitzpatrick. So we'll get pictures, and then we also do a follow-up with a questionnaire just to double check their Fitzpatrick. That's how important it is to get their skin type correct. Once we do all that, we bring the patient into this room. We go ahead, we use numbing cream on the entire face. We use a mixture of lidocaine 23% and tetracaine 7%. And we leave that on anywhere from 20 to 30 minutes, depending on the person. Once that time is passed, we come in, we cleanse the face, we remove that numbing cream, cleanse the face really well, and then we go through the steps. Now, with this particular procedure, Forever Young BBL, we get to choose whether it's the face or the body. And then up here is that select skin type. So that's that Fitzpatrick scale that I said that was so important. So if I choose someone's a Fitzpatrick scale, then there are several passes that we go through. So the first pass is the base pass. And that is really kind of a warm-up pass. I use the base pass twice. I start in the face and move across horizontally, and then I come back and do everything vertically to make sure I get everything done. So this is the handpiece for the BBL. So you can see the light is coming out. While we're talking about lights, the difference between a light and a laser. A light, you can see when a light comes out, the light goes everywhere, okay? Just like the lights in here. When a laser comes out, it stays in a beam. So lasers are very focused. And so that's just kind of the difference with definition. This has a cool touch crystal piece. So when I touch this, it's actually cool to the touch. This helps protect the surface of the skin from burning. When I use this, we have different hand pieces. So this is the one that I use the most for the base pass. And then it would just march right across the face. So once I do the base pass, we go over to the vascular would be for reds. So the reds that we're speaking of is the little vessels in the nose. Sometimes people get vessels on the chin. We get cherry angiomas. So those are the little spots that look like freckles, but they're red. So this is great for that. This is also great for rosacea. So people that just have generalized redness in their face. So this is kind of, it's unique to the patient. It's also unique to the area of the face that we're working on. So there is the pigment pass. So for browns, that would be the next pass. For the browns, we are using a smaller little spot size like this. I'm going to go over the entire face. If this is the first time I'm doing it to someone, I'm going to go over everything because there's a lot more brown under the surface of the skin than we can typically see. So it covers up, so these are called spot sizes. So there's round ones, there's smaller round ones for vessels. So these are how much spot size comes through. So this blocks the light so that this part is more intense. And it's really for safety. If I'm working around the eyes, I want to be more specific with where I'm going. If I'm doing a little cherry angioma, it's small, I want to be very specific right over top of it. So I kind of look at the BBL as kind of two parts. So there's the initial correction phase. So if I have someone that comes in that has lots of reds or lots of browns or they've never done anything before, that is where the treatment would end because I've gone over their face several times already. After the base pass, anywhere, I have people that don't look like you've done anything, and I have people that are kind of pretty bright red. So that kind of depends on how much they've had done, how sensitive they are to light. So sometimes that doesn't really, look much different. The redness, any vessels that someone has, anything on their nose or anything, because the light is absorbed by the blood in the vessel, that vessel will sometimes completely disappear right away, or it'll look kind of purplish, kind of purple or kind of like smudgy, just looks irritated. And then over the next couple weeks, those will start fading away. The cherryomas, when I get those, it'll pulse and they'll turn either dark purple or sometimes even brown right away. And then with the pigment pass, for the most part, the browns become more prevalent, they're more pronounced, and they're darker. So most of the people, when they leave, they can definitely tell that their pigment, they're like, oh, I didn't know I had as much pigment as I do, and they're darker. And then sometimes they'll continue to darken up over the next 24 hours before they start flaking off. So when someone gets into past that corrective phase and we start into the maintenance phase or what we call the forever young phase, those people sometimes may not have any downtime because they really don't have any browns that are coming out. And then those people we're focusing on skin tightening and anti-aging. So that they may leave here and they're a little pink, and that's the worst of it. Someone doing a BBL forever young, we recommend at least twice a year. Once in the fall, once in the spring. So if someone's never had a BBL before, or they've only had one or two, and they're trying to really get rid of browns, they can have probably 4 or 5 days of downtime. Now, I will say the severity isn't horrible. They can wear makeup starting the next day, but their texture will be a little rough. You'll be able to see those brown spots. And so I would plan on a good 4 to 5 days. So you definitely want to stay out of the sun after treatments because your skin is very sensitive to light now. This would be like going to the beach and being out in the sun Monday, Tuesday, Wednesday, and Thursday. You're like, oh, I don't want any more light. Well, this is kind of the Monday, Tuesday, Wednesday, and going out in the sun would just make it more susceptible to burning. So you definitely want to stay out of the sun, ideally 2 weeks on either side of the treatment, before and afterwards. I get BBL treatments twice a year, and then once a year I pair it with a halo. Right now, I've kind of removed as much brown as I can remove, except for maybe occasional ones that pop up from being in the sun. And then we focus on skin tightening. So this last pass, the Skin Tight with Forever Young, is an infrared light treatment, and it helps to really stimulate those cells in the skin to start behaving like they were years ago. I love the BBL because it focuses on color, and I think so many times people focus so much on wrinkles and lines that we forget that the quality of our overall skin and the tone of our skin and the evenness of our complexion really shows our age also. So I think it's a great treatment to really focus on the brown spots and get the complexion nice and clear. I also think that if someone's working on an anti-aging, which we all are, that's why we're doing these treatments, that doing something twice a year is manageable for most people. It's, you know, yes, you have some days of downtime, but it's something that you can do twice a year and get great benefits from. BBL Forever Young can be combined with other treatment. It actually pairs nicely with another treatment that's on the same device called the Halo. The Halo is a laser treatment. It's an ablative and non-ablative fractional treatment. So non-ablative means the laser is not actually removing any skin from the surface. It's going down deeper to stimulate collagen and elastin. The ablative laser, any ablative laser, is removing tissue. And the way the halo works is instead of it removing it in 100%, it's removing it in little channels that help to also stimulate collagen and elastin. And the two treatments pair nicely together because they work synergistically. If you're doing the treatments together, we would always do the BBL first and then the halo. But typically we don't combine it with any other treatment besides that. I wouldn't say it necessarily hurts. Some places don't numb at all, and that is okay too. It's really the clinician's preference. So it does kind of feel like with each flash, you feel that heat and kind of a little, I'll call it just like a little zing. Now, depending on where you're at, some parts of the face are more sensitive. So even with numbing cream, sometimes you feel little spots. If you have more pigment, you're going to feel that a little bit more too. So as the owner of this med spa, I feel like my name is tied to every treatment we do. So when someone comes in here, I want them to feel like they got the best treatment possible. So I only have equipment that I feel like is the best in each one of my categories. And I've loved this machine. It does a great job. I know when someone comes in that they're going to get great results and they're going to come back because they love how their skin looks afterwards.